In this demonstration, we will see how the NNUNet models perform as far as the segmentation is concerned. We are giving a visual overview. As you can see the model quantitative metrics on our website. In addition, when you select a model, quantitative metrics like the dice similarity index, the median house draft distance, and the over contouring under contouring distance metrics are also available. Here the mouse pointer is showing the eyes and the optic structures, pituitary, optic nerve, brainstem, and all of these are head neck OAR models which are derived from the head neck model. So you can see that the performance is quite reasonable, and we can see as the contour goes down we have segmented the DAR structure, which is generally a difficult structure for auto segmentation models to segment. Our larynx segmentation may be different from what you are segmenting, and this is one of the advantages that we have with this system, is that we can accommodate your contouring practices, and in addition we can also train models which are adapting to new guidelines as they emerge. Now in the sagittal section we can show the levels of the spinal cord and the brainstem, and this is as per the guidelines which are followed at our institute. In the next case we will see that the performance of the model in a more thinner patient. Now this patient we have selected particularly because the body mass index is quite low, and this has been a problem when we evaluated segmentation solutions generated from the West, where models were trained on more obese patients. And we can see that because our training dataset was representative of the Indian population, we got a reasonable model performance even for this patient. In fact, all the structures have been drawn. Now let's go on to the breast model. Now this is a patient of breast cancer, and we can see that the brachial plexus are being segmented on the both the sides, the SCF volume, the internal mammary nodal volume. The breast volumes on both the sides are drawn as per the latest ESTRO guidelines. You can see that the contours match the breast contours quite well, and this is because of the training dataset that we have used. Liver, heart, lung, spinal cord, esophagus, everything is drawn. In addition, we have also drawn the left anterior descending artery, and therefore this model promotes the concept of drawing of cardiac substructures. Here we are showing the results obtained from the prostate model, and the prostate model was actually the first model that we trained. And you can see the bowel bag, the nodal CTV, the bladder, and as we come down the anorectum and the femoral heads as well as the prostate gland are segmented. The penile bulb has also been segmented. Our prostate model performance is quite good for most of the organs except for the superior aspect of the bowel bag, where there is some variability which is reflected in the modern performance. This is the segmentation of gynae cases. Now this model was quite interesting because we only did this training with a very few number of cases. And you can see that the performance in terms of segmentation of the para-aortic nodal region, kidneys, abdominal organ, etc. are quite reasonable. Here we are highlighting the possibility of nodal substructure solutions, and here external, internal iliac, obturator nodal volumes have been separately drawn. Now as we are showing in this, again this shows how flexible our model is. So we can accommodate different types of guidelines and different types of requirements for your model segmentation needs. The next model that we will show you is new. This is something that we have trained over the last week, and this is MRI substructure segmentation, and we demonstrate using this method that our model is capable of doing multimodality segmentation. These are substructures drawn in the brain like the orbitofrontal region, the eye, retina, cornea, the brainstem, amygdala, hippocampus, and the supratentorial brain, as well as the superior and the inferior part of the cerebellum. As we can see that these complex structures often take more than 30 to 40 minutes for our fellows to draw as per the ESPT and Atlas. And this segmentation can be performed within 3 minutes using our draw system. One of the last segments that we wanted to demonstrate, and this would be quick, is planning structures. Now, our physics planning structure drawing is often quite complex in order to meet the OAR constraints for BREST, and all of these substructures that you are seeing have been drawn by the draw system. So, if your physics planning system utilizes a very formalized way of segmentation of structures, we can help with generating model for generating your substructures. Thank you.